All right, I think, Katie, if you're ready, with 2 minutes after the hour, we can go.
Okay, great. Hi, everybody. Welcome to the call today. We have a fairly straightforward agenda. We have colleagues from the Global Fund Secretariat joining us today to speak about the replenishment, a bit of a debrief. It feels like ages ago already. But it wasn't actually that long ago. And we're all still working on this rolling replenishment. But so looking forward to hearing from both Francoise and Diane from the Global Fund Secretariat who are with us today. And then we have two brief things that we just wanted to share around UHC Day, which is tomorrow, and share some of our plans and some of our materials. And then also just wanted to share a little bit of information on this call about some other calls and some other organizing that is happening around the U.S. government memorandum of understandings with countries, bilateral understandings that many of you will know. Those negotiations are sort of ongoing, and we do have some colleagues across civil society who are organizing around that and that we've been linked in with, but we wanted to make sure to highlight their work and let everybody know what's going on so they can join those calls and, get to be a part of and contribute to those conversations as well. So we do have translation available on today's call, which was probably said earlier, but as many of you are joining, don't hesitate to use the translation for French if that would be easier for you. We welcome you to join and utilize either language that you are comfortable in today. So I will pass it over to our colleagues from the Global Fund Secretariat. We do have a presentation from them, which by the look on Quentein's face is that he's just pulling it up now very intently. There it is. Isn't that wonderful? So Francoise, I see you are wearing one of the beautiful fabric activation parts from the replenishment, which was such a lovely feature in Johannesburg. So I will pass it over to you to lead us off, and Diane, and then we'll open it up for discussion and questions and answer from colleagues. So Francoise, Diane. Oh, Diane has also got lots of the fabric going on behind her. So this is wonderful. Francoise, over to you first.
Thank you. Thank you so much, Katie and Quentin. And good morning, good afternoon, good evening, everybody. I'm glad that you've immediately noticed that Diane and I are fully branded with the fabric themes of this replenishment. So thank you so much for making the time for this debrief today. It feels that the summit was some time ago indeed, but it was just a few weeks ago, and we are still recovering, while at the same time following up on the anticipated but not yet announced pledges. So still quite busy, as I'm sure you all are. So let me start by just saying that it's been a long and bumpy and complex and intense campaign. But I think our culmination moments with the summit a few weeks ago was really a successful summit. And we'll share with you some of the highlights. With a strong result on the day, and then the results that we now have that has gone up and will continue to go up in the coming weeks, we hope. So overall, we have a very inspiring story to tell you about the achievements so far. And above all, a big thank you to all of you on the call and not on the call who have joined this crazy campaign, and those of you who were in the room with us in Johannesburg for the summit or joined online or watched afterwards on the website. So let me kick us off. I'll speak through what happened at the summit for those who were not there and just want to hear the headlines of the summit itself. And then Diane will talk us through the journey to get there and unpack for us some of the numbers and next steps. So we can go to the next slide, please. So the summit, as you know, was in Johannesburg. Next slide, please. On the 21st of November in a hybrid format. And we, alongside the approach to our replenishment campaign, we really tried to balance substantive content with emotions. And we started with a lot of emotions with these, I'm not sure I'm going to get the pronunciation right, Ndlovu Youth Choir, which provided an absolutely amazing choral interlude to open the summit. And at the end, it was so inspiring that President Ramaphosa asked them to come back on stage with him and give us an additional song. So this is how we opened the summit. You can go to the next slide, please. And then immediately we had the opening segments with high-level speakers, very much with a rallying call for solidarity and recommitment to the fight against HIV, TB, and malaria, and to the Global Fund. And you can see on this slide that we managed to get the high-level speakers, obviously from our co-host, Minister Motsoaledi from South Africa and Baroness Champman from the UK, but also a very powerful video from Amina Mohammed, the UN Deputy Secretary General. We also had Dr. Tedros from WHO speaking at the opening segment, but also attending the event, and representation from across the partnership with representation from the private sector delegation and from the 3 civil society and community board delegations as well. So we had a very powerful opening segment that concluded with Peter's presentation stating that the world has changed and we need to change and sort of adapt and shape it keeping the same spirit that created the Global Fund in the very first place, but reinventing ourselves to make sure that we meet today's realities and needs. Next slide. Then we went straight into a pledging session that was organized alongside key themes that had been selected by our co-host or together with our co-hosts, and very much resonating with the themes picked up by South Africa for their G20 presidency. So solidarity, sustainability, innovation, and equity. And for each of those themes, we had a number of donors and partners announcing their pledges and commitments. And so we had a long but important session where all of the partners you can see on this slide came up with their pledges. Some of them, as you know, mentioned their continuing commitment to the Global Fund, but they were not in a position to announce the pledge yet. They have a little asterisk next to their names, and we are obviously following up very closely with them to secure the pledges on time for the allocation and ahead of our board meeting early February. So a lot of follow-up to be done there, but it was a very interesting and inspiring session as well. Then we moved into the next slide, please. Oh, these are some illustrations of these pledging session that I've just described, when you can see some of our key partners speaking either on video or from the floor or live, but online as well. We had all the different formats. Next slide, please. And one of the highlights of this segment was that we had a number of private sector pledges that were announced, and that led us to the remarkable $1.34 billion raised from the private sector for this replenishment, which is an unprecedented outcome, so something we are very proud of. And we are going to follow up with some of the private sector partners to see how we can further increase this remarkable result. Next slide, please. And of advocates. So we were very proud to be able to bring into the room 4 advocates from different corners of the planet who have been sharing with us their stories, and whose stories have been translated into the fabrics that many of you would be familiar with. And we were very lucky to have them all in the room. So Sibulele from South Africa, Annie from Indonesia, Ivan from Bolivia, and Nuruddin from Nigeria. It was quite an endeavor to make sure that they reached South Africa on time from very far away. But it was extremely powerful to have them all on stage, telling their stories and their fights, and very much inspiring everybody in the room and online to continue the fight. Next slide, please. Oh, and in the middle, we had a wonderful spoken word poet from South Africa who brought all the stories together in an extremely powerful way. And then we had a closing leadership session with our co-hosts. Again, so our Prime Minister Keir Starmer from the United Kingdom and President Ramaphosa from South Africa, delivering very powerful remarks at the closure of the event. As you can see, President Ramaphosa is also wearing Cebu's fabric on his neck, and he also announced the outcome of the replenishment at that time, which was at that time 11.34, as I'm sure you would have seen on the day, but we've continued building on that number. So we'll look into the updated number right now. Next slide, please. And this is another view of the final segment, the final picture with President Ramaphosa, Peter Sands, Lady Rose, our chair, and the four advocates I've just mentioned. And on the left, you can see the speakers of the final high-level segment, where we were very lucky to count on the presence of the Prime Minister from Norway, from Ireland, and the Vice Chancellor from Germany. Who were all attending that and speaking at that final high-level section of our summit. Next slide. So I hope that gives you a little bit of a flavor, if you were not attending in the room or online, of how that looked like. Here you can see also during the high-level segment, the high-level speakers on the first row, and you can see also in the background the fabrics decorating the space. Next slide. And sharing with you also a little bit of the numbers when it comes to the attendance to the summit. So I've mentioned we've got high-level representation from South Africa, the UK, Norway, Ireland, also Central African Republic. We had overall 17 ministers represented at the event, and in terms of the broader attendance, we had over 700 registered participants, including 480 in person. So significant attendance coming from 43 country delegations, 31 private sector delegations, 14 partner and multilateral organization delegations, and over 375 individual guests. So quite a well-attended event. And from our accounts, but you may know more, we had approximately 70 people and all computers connected through the GFAN retransmission modality. So hopefully many of you were able to follow online. Next slide, please. So all of that, of course, is the result of the culmination moment of a year-long campaign where we have worked very closely with all of you. And it's obviously the result of a very intense collaboration, engagement, and advocacy throughout the year. So that's a little bit of a recap of the journey, the road to the 8th Replenishment Summit that we started early this year in January with the first pledge at the World Economic Forum in Davos, followed immediately by the launch of the 8th Replenishment campaign in Johannesburg back in February. The many events along the way that we've been leveraging to secure pledges, early pledges. Remember, we started with this rolling replenishment approach that has proven successful in helping us securing pledges as early as possible along the way, as you can see on this slide. And then arriving at the summit in November in Johannesburg. And since then, we now have raised even more or secured even more pledges, and we are now at $11.86 billion pledged, and with more to come, as I said. So just a bit of a recap of the way we've worked together this year to reach that point. We know, of course, that this is not the full results yet. We still have more work to do. And of course, we also know this is not the $18 billion of the investment case. Yet, we think, given the current circumstances, it's a very strong result that we have achieved together, and certainly something that we can build on in the coming weeks and months. So I'll stop there and hand over to Diane to unpack a little bit more all the key elements of this quite extraordinary campaign. Over to you, Diane.
Thanks, Françoise. So if we move to the next slide, we'll talk a little bit about the co-hosting arrangements that we had. As I'm sure you're all aware, it's the first time we've actually co-hosted a replenishment with South Africa and the UK, jointly doing this together. And this was particularly important because both for the launch and then for the culminating moment, we were in Johannesburg on the African continent with our replenishment for the first time. The co-hosts worked together really closely throughout the year. It was, frankly, a very intense collaboration with a lot of people involved on both sides. And together they launched a joint vision, which you saw reflected in the themes that Françoise was explaining during the pledging session, of solidarity, sustainability, innovation, equity, and transformation. And I'm sure you both heard those messages and were aware of the short films that we did to introduce each of those themes during that final summit. But it was really embedded in the campaign throughout the year with what the co-hosts wanted to cover. And they work together in many places, hosting events, not just the launch and then the summit, but several platforms in many capitals throughout the year, but most particularly with the State Secretary and the Minister for International Relations and Cooperation of South Africa in New York, London, and Johannesburg, holding events, hosting platforms, and creating space for people to pledge. And they've continued to do that, actually. Both co-hosts, the South Africans and the UK, are working closely with us to secure the remaining pledges that we're still going after in advance of the board meeting in February. Next slide, please. We also, as we always do, used political processes throughout the year, and this year with the G20 host also being the host of our replenishment, we have been able to participate in all of the G20 health track meetings, as well as the C20 and the B20 in the lead up to the summit. There were a lot of policy discussions on global health, on equity, on building resilience, and Africa's the Accra reset and health sovereignty. And you saw that we were actually referenced in the final leaders declaration that came out on the 22nd of November, just after our replenishment summit, noting that the Global Fund is a vital source of international multilateral funding to combat infectious disease, strengthen health systems, and fostering global health security. So we're very pleased with that political engagement throughout the G20 and G7 processes. Next slide, please. We've also advanced our approach of ensuring political support in as many countries as possible through our MP engagement. We had events in Parliament in multiple countries, and also site visits of parliamentarians to Uganda, Namibia, Kenya, Zambia, Ghana, lots of in-country events, and lots of engagement through various parliamentary groups and platforms. So that has been really important, and it will continue to be important for us to be able to convert the pledges as we go forward. Next slide, please. We also had a huge number of partner country champions who engaged with us, both at the regional level in Africa, but also across countries. And I have to say, we didn't have to do a huge amount on this. The countries themselves were very keen to engage, very keen to talk about their commitments to domestic resources and their partnership with the Global Fund. So that's been really great. And then at the World Health Assembly, at WHO Afro, at other regional meetings, at AU platforms, UNGA, the G20 platforms, there was a huge amount of engagement from African leaders, African ministers of health, and so on. And you saw that represented also in the summit. Next slide, please. It was a particularly strong campaign for the private sector. with a lot of focus on innovation and equity coming through private sector commitments. A lot of this was showcased in our events, particularly in New York, London, and at the B20 in South Africa, with a lot of private sector pledges coming in early, which was particularly helpful. And partners such as the World Economic Forum, the Clinton Global Initiative, Global Citizen, and others helping us to provide showcases for private sector engagement and support to innovation. They also helped us with our public sector campaign, turning up at events targeted at public donors and helping us with that advocacy. Next slide, please. So the civil society engagement, as always, has been incredible. And I want to really thank you all of you GFANers and everybody working in the many, many countries where we engage, because I think this year really required exceptional adaptability and flexibility on your part. And the fact that you were willing to collaborate with us in a very difficult start to the campaign at the beginning of the year. And then as we built up momentum in the campaign, you were really supportive, came along with us, were noisy when it was time to be noisy. And we loved the innovation and creativity of the campaigns that you did to support us. There were so many letters written, sign-on letters, letters of support directed to global leaders, to private sector donors. You participated in so many of the events we did in Capital alongside our co-hosts, or creating your own platforms. So we've really been appreciative of that. I love the GFAN tools and all of the things that you did, the Here I Am videos, and all of the campaign support that you've provided us. And a huge thank you to those of you who came to various capitals for events. It's really greatly appreciated, and there's no substitute to real sort of engagement from people who are involved in the programs on the ground. Next slide, please. We, of course, continue to work with our technical and global health partners throughout the landscape. There was a huge focus on transformation, on the changes needed to the global health landscape, on issues around the architecture and so on. I know that many of you are engaging in those consultations regionally, in your countries, globally. Thank you for that. I think it's really important to highlight the key elements of the Global Fund model that continue to deliver for communities and for civil society, and to make sure that that is not lost in this wider discussion about alignment and change to the global health architecture. So it was great that our partners came along on this journey with us. Next slide, please. As I said, it was a little bit of a quiet start this year in terms of media and social media, and we greatly appreciate your willingness to be a little more cautious and careful at the beginning for visibility for the Global Fund, while we tried to figure out exactly how the landscape was going to change this year, and because there were many elections in many countries as well. So we were very tailored in our strategies, but it did gain momentum over the year. And after a very quiet start, I think we had a lovely loud ending with a lot of engagement around the G20 and with our 70 Million Reasons campaign film, 8 million views of that film and still counting. And many of the other activations have really generated a lot of engagement. Our fabric advocates, our fabricates, as we're calling them, were absolutely amazing. Their personal stories so moving, and there was a huge engagement around them, their stories, and the way in which we were able to showcase them at the final summit. So next slide, please. In the end, the outcome, as you know, is provisional. So next slide, please. We are, as Francois said, at 11.86 billion, with more to come. There is a great deal of work going on with the donors who were not able to pledge on the 21st of November. There isn't a donor that was on our list who isn't in a very active conversation with us at the moment. We're hoping that they'll be in a position to pledge before February so that their money can be counted in the sources of funds for the allocations. But we will not stop there. And there are a number of both public and private sector donors who we know might take a little bit longer into next year. And we will continue to pursue those pledges and augment the funding as we go along. Next slide, please. As it stands, there was massive commitment from the G20 member states, reaching nearly $9.5 billion, showing that the political consensus that the Global Fund is still a worthwhile investment is there. And with those commitments, we were really able to show that there is an understanding of the role of multilateral financing for health and what it can do. We're particularly pleased that one of the G20 members, the Republic of Korea, has now qualified to join a voting donor constituency. These are part of the incentives that the donors put in place to get new donors to continue to commit over a long period of time to qualify for a voting seat. So that discussion is underway. And you'll see a nice big piece of the pie was private sector donors who really have stepped up, and we expect to keep working towards our stated goal of $2 billion from the private sector during the 8th replenishment, and we're actively working on getting more of that money in, as I said. Next slide, please. We also had wonderful commitment from the African continent. So there were solidarity commitments topping $51 million, which is wonderful, including a really landmark pledge from the government of South Africa, who doubled their pledge. With the highest increase amongst the donors, which was very, very welcome. The South Africans are also leveraging private sector donors in South Africa. So we expect to receive more money from the private sector in South Africa. And then, of course, all of the African leaders emphasize not only their solidarity pledges, but their own increases and commitments to domestic resources, which is so important going forward as we talk about health sovereignty and continued commitments to health financing in the national context. Next slide, please. The private sector breakdown, as I said, is quite unprecedented. Our largest donor maintained their commitment, the Gates Foundation, at $912 million, with our new emerging fast-growing donor, the Children's Investment Fund, at $135 million. And actually, they have pledged a total of $200 million in the last couple of months, but they don't like to hang around. So they've asked us to already start spending some of that $65 million of that already being implemented under the 7th replenishment. So they wanted to get started straight away. And we have a number of other private donors that have reached a total of about $214 million from a range of other donors, which is really great. Next slide, please. So quickly on next steps and where we go from here. If we go to the next slide, thank you. We obviously are not finished. So there are a number of donors, as I said, that we still need to chase down. But of course, our main job now in the next couple of weeks and months is to thank the donors who have committed. We're making sure that they understand how much we appreciate that commitment and that it matters. We will continue to raise money. There are missing pledges. There are also, we hope, opportunities to increase some of the pledges that might not have been at the level that we were expecting. And so we will continue to work with donors both to convert the pledges they've made and see if we can get additional pledges going. There's a huge thank you campaign underway to thank all of the donors, the champions, the advocates, all of you civil society partners who helped us make this happen. And of course, rapidly integrating Korea into a voting donor constituency will be a good demonstration of what it means to expand the donor base and quickly ensure that those donors feel welcomed into the Global Fund family formally as voting members. We've got a lot of work to do to make sure those pledges are converted, as we've said, and to make sure that any of the technical assistance withholdings, as you know, we have set-asides in many of those pledges. So we have to make sure that those set-asides are going to work for the Global Fund partnership and help create greater impact on the ground. We'll also be doing a lessons learned exercise, and I'm sure Katie and the GFAN team also has some plans to do some reviews and think through what was successful, what went well, what we can do better next time. And we welcome conversations with you all about what we can do better, what worked, what didn't work. So we'll be doing all of those consultations over the course of the next couple of months. And then, of course, we've got the ongoing work. We have to provide lots of good stories of the impact and the way in which this money is being used to good effect, to make sure that we can continue to raise money and to convert the pledges that we have. There was a lot of promise outlined around transformation and change, both within the Global Fund and in the global health architecture, that we're going to need to live up to. But most of all, of course, we have to showcase the human side of what we do. We have the money now. What is going to be the impact for individuals on the ground? And the strategy committee has been talking about that over the last 2 days. How are we going to make sure that every single dollar we've raised changes lives on the ground, saves lives, and improves the health and well-being of everyone? So we look forward to working with you on that, and we will continue to provide information and report on how the ongoing resource mobilization is going. So thanks very much. Back to you now, Katie. Thank you.
Thank you both very much. Appreciate the overview and appreciate the clarity in terms of sort of the next steps and what the work involves. And I think it's always nice to highlight. I can't remember the last time a new donor was incorporated into the donor constituencies, and so that is actually kind of exciting.
2006.
What's that? 2006.
2006.
Yeah. Okay. So there's a reason I don't remember. I wasn't actually a baby, but I wasn't in this work yet. So, but Diane, I think you were. But no, that's really fascinating and really interesting. So, just opening it up to everybody for questions. We don't seem to have a very active chat yet, but I suspect that might change here in the next few minutes. But opening it up to questions, please use the raise hand function. I think a question from a lot of colleagues is, and I think I know the answer to this, but I think it bears sort of asking the question so that more colleagues are aware. We are all pushing in our different ways in terms of getting as many pledges as possible before the board meeting. And the reasons for that include that that's the most direct way to make sure that there is that sort of allocation methodology that is, very widely discussed, very, intently decided on how it works, put into play with that funding. Can you talk a little bit about why that is so critical over the next sort of month to 6 weeks, just from your perspective as the Secretariat, for colleagues who may not sort of follow those board sort of progress and processes as closely? And I would just note for all colleagues that we are hosting a call next week that is intended to be more of a learning call around these kinds of process type questions. But I think it would be helpful to hear from the Secretariat in terms of how and why you're really pushing that sort of before the February board meeting is so critical, so that all colleagues are aware. And I'm struggling a little to see, I've got so many different windows open. So I'm just trying to see here if there are any hand raised. I'm not seeing any hands raised, so maybe I'll have the privilege of being the host to lob that question at you both and ask colleagues to raise their hands using the raise hand function or pop into the chat if they have a question that they'd like to raise. But Diane or Francoise, over to you.
Thanks, Katie. I can start and on this one. So first of all, we do have a number of donors, including long-standing large donors, who have clearly indicated their commitment and their willingness to pledge as soon as their national processes would allow them to. So that means that they have basically opened the door for us to continue pushing to get the pledges on time. And they are fully aware of the timelines and the criticality of getting their pledges confirmed before the board meeting and the allocations. Why it matters? Because when we get the pledges on time for the board decisions on allocations, that means that we are able to send letters to the 120 countries that we support with the allocation they can count on for the next 3 years, meaning we can provide them with predictability and we can support them in building funding requests that really take into account the full amount that they are expected to receive over the next 3 years, and therefore have really a predictable, solid, long-term planning exercise for each country. We still obviously welcome pledges along the way, and we always continue to fundraise in between replenishment moments and conferences. But then it's not the same, right? Because it doesn't fall into the pot that is allocated right away, and that allows countries to plan ahead. In that case, obviously, the money is still welcome and is still incorporated and then allocated through a more complicated process that is called UQD, and funded quality demand. So the things that countries have not been able to secure funding for, and if these additional funds come from the private sector and are earmarked, then they are directly allocated to the catalytic initiatives that they have decided to support. But the main reason is predictability, really.
So we do have some questions popping up there, and I'm wondering if now, because we're not in a webinar format, so I don't know why I don't see any more hands raised, but we do have a few questions there that sort of, I think, come off of this in terms of milestones for some of those big countries that we're hoping to see the pledges from after the indications of that there will be one coming, how the Global Fund manages US dollar sort of fluctuations. And the famous question around the two countries co-hosting the replenishment and what some reflections are and whether you would sort of look for that afterwards. And then there's also the set aside question. So maybe I'll pass that over to you guys to answer some of those either in the chat, but also seeing, sorry, see, this is where my computer's not. Oh, there we go. We have Robin, Montgomery, and Angela with questions. So maybe if it's okay, we can ask Robin and Angela to come in with their questions, and then we'll go back to you. And we'll also try and help start some of the answers in the chat. But Robin and Angela, thank you.
Thanks so much, Katie, and thanks, everybody. Can you hear me okay? I'm in the car.
Yes, we can hear you.
Okay, perfect. So my question is a cheeky one, but also a strategic one, I think, that we all need to be aware of as we go into grant cycle 8. And that question is around conditionalities. If we could get clarity on that, if there are conditionalities tied to the US pledge. Thanks so much.
Thanks, Robin. Angela?
Thank you, Katie. It's Angela from Women for Global Fund. And my question is mostly related to the lessons learned as per the strategies of advocacy that you find were more useful and the ones which were not, and why. There are some also like advocates, specifically from the movement in which I represent, asking like, why don't we make the letters to the countries also like available, like public? Is there any change and shift on the strategy approach at this time? Is the pressure enough for the governments or the donor countries? We are not seeing specifically like all the commitment that we wish for. And is there any shift or lesson learned that we can take on the advocacy strategies to improve and keep on the next few months? And what does this look like? Thank you.
So Diane or Françoise, maybe, I'm not sure which one might want to start, Diane. And yeah, go ahead.
And thanks. Yeah, I'll start a few of them, and I'm sure Françoise will add. Just quickly on head of the board meeting, obviously we're trying to get as many donors to pledge as possible. We don't really need pledging platforms. They just need to pledge, send us a sheet. I mean, we'll create some moments for them if they want, but quite frankly, right now, the whole idea of the rolling replenishment is that we just get the donors to pledge, and we don't need a big fanfare in order to do it. So that is the plan. And as Françoise has said, even if that money is not absolutely available for the sources of funding by the board meeting, it doesn't mean that money gets wasted, right? It is the most equitable way for the money to be channeled, because it goes into the full allocation and all of the good knock-on effects that gives for catalytic investments and other things. But when we get funding after the February allocation, there's plenty of need to which that will be channeled. In terms of the US dollar, at the moment, it's primarily, in some cases, working to our advantage, because there are several donors who are pledging in euros or Swiss francs or other currencies that are quite strong against the dollar, which gives us a good turnout. But of course, our finance team hedges all the funding anyway to make sure that we don't have too much impact of exchange rates on the actual sort of outcome and how that's worked. And since it all happens over 3 years, a lot of exchange rate change happens over the course of any replenishment cycle, and that is managed by our finance department. Sticking with financing at the moment, in terms of the US pledge and the set-asides, actually, Katie, we will eventually be very transparent about exactly what set-asides are available. It's just some donors have said they're doing set-asides and haven't told us yet exactly what the percentage or fixed amount will be. So we're busy negotiating all of those things. But all of that will be incredibly transparent once we get to the sources of funding discussion at the board. We're not there yet because we haven't finished raising all the money, and finance will be doing those calculations, both taking out the set-aside and making money available through the sources of funding rules that you all know are established by the AFC. So that is a work in progress. But essentially, the 11.86 is pledges right now. It's pledges. So that includes set-asides and anything else. As we know, the US only mentioned 2 things about their pledge. For those of you who watched the video, they said the condition that they are retaining, which has been a condition of the US pledge since 2002, is that other donors must pay 33% of the funding. They will only pay 33% of the funding, excuse me. And so other donors need to provide the other 66%. So they're capped at 33%. So the 1-to-2 match needs to work over time. So during the course of the replenishment, we're very confident we will absolutely raise enough money for that match to work. And the other thing they announced is that they will not be doing a set-aside. So in fact, the US pledge amount is the complete amount, and it goes into the sources of funding discussion that goes into the discussions for the board meeting. So hopefully that clarifies some of those things. And to Robin's point, that is the conditionality that has been announced by the US. And we don't expect other conditionalities that would prevent the board from deciding exactly how all of the pledges, including the US pledge, will be spent. So it's according to the Global Fund strategy and our allocation methodology, which, as you know, is was set in Malawi last year, with some tweaks to the economic curve and prioritization of poorest countries, things like that. So those all stay in place and have been discussed at the strategy committee over the last 2 days. So that's the situation right now in terms of all of the pledges. I don't know, there might be other things I haven't covered, and Francois, you might want to add.
Thanks, Diane. I think that was quite comprehensive. Just picking up perhaps a couple of questions that were raised in terms of the co-hosting and the advocacy, the things that perhaps we would do differently or we need to reflect on. I would say it's probably a little bit early, because we want to really engage with you all to run this lessons learned exercise that Diane outlined, but perhaps a few things that are already quite obvious. From a when it comes to the co-hosting arrangement, I think it made a lot of sense, if you think about the geopolitical landscape, to have a co-host from the G7 and another co-host from the G20. It really provided this platform, solid platform, to embody the Global Fund model, and to really speak about partnership, global solidarity, equity in a powerful manner, and to have their complementarities leveraged to really build up the momentum and encourage donors to commit and pledge. So we think it's been a positive innovation and a very powerful modality, but for sure there are a few things that we need to unpack to see whether or not it's a model we want to replicate and how in the future. But overall, I think we've been quite satisfied, and our expectations indeed were met with that modality. And when it comes to advocacy, similarly, we need to unpack further. But one of the things that have come up very clearly has been the fact that the voices from the implementing country leaders has been more important than ever. And really having the champions that Diane spoke about also in the presentation, heads of state from Africa, ministers of health from Africa and other places of the world, really making the case for the Global Fund, why it matters, and how the Global Fund complements their efforts towards self-reliance and more sustainable health investments in their country has been more important than ever, given the geopolitical landscape we found ourselves in. And we have also found that the voices from the private sector were extremely important advocacy-wise. And the last thing I would say in that space, and that the voices from the communities affected by the diseases and civil society remains really core to our advocacy ecosystem and the success of this replenishment. And we've been, I think, working in a very agile and aligned manner with our advocacy partners, complementing each other, and really making sure that we would not sort of go into different directions, navigating the very challenging political landscape that we've faced this year. So some of those lessons also include the themes that our donors have been very keen to hear about. In a way, the Global Funds model and the impact that we've been achieving remains at the very core of everything we advocate for, but we add a number of dimensions, or to deepen a number of dimensions in our advocacy, in particular global health security, return on investment, global health transformation, and a few other themes that have taken more importance to make sure that our messages were heard by the key audiences. So these are some of the thoughts, but much more to come in Q1 next year when we unpack all of that with your inputs as well. Back to you, Katie.
Thank you. There's a couple of questions that David Bryden has just popped in around that's specific to sort of the US sort of MOU conversations and some of the conditionalities that are expected out of the US, at least in terms of its bilateral funding as a minimum. And what I was going to suggest is, Françoise and Diane, are you able to stay on the call for the next few minutes? Because we did want to switch to giving a little bit of an update around the USG MOU sort of information. And then maybe if you're able to either address those questions in the chat or in the conversation and discussion around that, that would be great. But just because I do want to try and get us to the other sort of two things, and that means Conte and Chase, I'm just sort of reversing our agenda just slightly to ask us to do the malaria control and health systems one after the MOU, the USG one. So Conte, I think I'm passing over to you for a really quick overview, and then just highlighting for Françoise and Diane the two questions on that in the chat that either you can pop up online, and say after, or perhaps you can add context in the chat. Conte?
Yes, thanks, Katie. And so very quickly, because the US government has been, if you follow the news, the US government has been going around Africa, signing bilateral MOUs. The first two were signed with Kenya and Rwanda, and I've seen, I think a couple of hours ago, Uganda being announced as well. There seem to be attempts at restarting some of the programs that were originally funded through USAID and PEPFAR. There is very little clarity on what they will actually be funding. We only know that it's health, at least in theory. Thanks, Margaret, for Liberia as well. Sorry, I missed that one. And so the other problem is that these MOUs include a lot of far-reaching clauses, in particular with regard to data access, and they are negotiated on an ad hoc basis, meaning that as far as we know, and I don't, I get all of my information from David in the chat and Emily Brass, friend of the show, and I'll link to all of these people, beautiful resources in a second. But just to say that our understanding is that nothing is really off the table when the US government comes into these negotiations, and so we don't really know what sort of things will come out of them. So far, it's been a lot of things on data access. It could be other things as well in other countries. The calendar for these, for the negotiations and the US visits is unclear, and we've been hearing things one at a time. So you need to keep an eye out from various channels sort of here when things might be popping up. There are a series of listening calls that have been organized among others by David Bryden. And David, you need to shout very loudly if you're not okay with me sharing your email in the chat for people to reach out to you to get added to these things. What I'll do is I'll remove that from the message, and you'll get to type in whatever email you want people to reach out to afterwards. The other resource that has been very useful and very up to date, and one of the few places where you can read on this, is Emily Bass's Substack, and I've put a link in. The Substack is entirely free, so you really shouldn't skip it. That's that for us, and I want to encourage perhaps anyone else to add information on the chat if there's anything more to say.
Thanks, Quentin. Diane and Francoise, I know they're not easy questions that have been asked, but any reflections on your side around how the Global Fund is supporting and or managing its conversations with countries in light of these conversations with the US and some of our important implementing partners?
Perhaps,
Sorry, go
ahead.
Yeah, Francoise has put it in the chat anyway, but just to compliment, we are an observer to these processes, so primarily they're in support of the countries. As you know, the Global Fund country teams always participated in the COP planning processes of PEPFAR. So that was an annual process that was quite intensive. It seems so far these MOUs are multi-year MOUs, so in a way that's already an improvement that we don't have to negotiate these COPs every year. And in fact, as many of you will know, the country operational plans for PEPFAR could change quite drastically from one year to the other, which made it quite hard for Global Fund programming and CCMs to manage all the shifting ways in which the funding was moving around. So our objective in sort of joining these discussions has been to make sure that everything is complementary and that we're there with the country explaining where the current Global Fund investments are and where we plan to invest over the course of GC8, so that we ensure that the US money is used as effectively as possible in these countries and is targeted to areas where there are real financing needs. So that's currently what's going on. I agree with what's been said around the lack of predictability around the timing. I think even for the US teams themselves, it's been an extremely fast and moving target in terms of where they're going to be and when. I think we were actually in country, colleagues from GMD, for many of the first round of countries. I think there were a few countries announced and probably David's information is probably better than ours, because the countries, a new wave of countries was just announced a couple of days ago, if I'm not mistaken. I do not think Global Fund staff will be able to be there. I think we'll probably consult with countries remotely if needed. And if in any way we can be supportive, we will be. But it's not possible for us to participate, I think, in the next wave because it's all happening very, very quickly. And my understanding is, in fact, that many of the next wave of countries are being negotiated in country. Not people from Washington, so local staff in the embassies with government officials. So that is what's happening, and it's GMD. It's all of the country teams who are as they always would be engaging in the COPs. It's the country teams who know what is in the grants who are discussing on that, and that's all. In fact, some of the leadership, Mark himself was engaged in one or two of the conversations. But as I say, now it's really country teams doing it remotely from now on.
Yeah. Okay, so country teams, that's helpful. I put something in there about trying to be clear about who it is in the Global Fund who's kind of trying to observe or follow these. So that's really helpful. Thank you both for jumping in there, and thank you, Conte. We would like to just also share, I feel like we're now jumping around in these last 10 minutes, but we did just want to share some UHC Day, which I think is tomorrow. I keep getting it messed up in my head in terms of the dates. But Chase, if I could invite you to share some of the tools and the work that we've done as GFAN in preparation for UHC, which has also been shared on our listserv. But Chase, over to you for a really quick update before we have to close out our call.
Yeah, thanks so much. And yeah, I'll just give a quick overview. Apologies to the interpreters if I go fast, but the brief really emerged out of this focus on the link between the malaria burden and health systems in countries with endemic malaria, in the context of the fact that they might be facing their first decline in malaria support since the Global Fund launched, in terms of constantly increasing budgets and then sustained budgets. And in that context, there's been a lot of focus on the data about the impact of malaria programs on cases and deaths. That's been well spotlighted. But something that has been less focused on and often overlooked is just how that funding has contributed to dramatic declines in the number of outpatient visits and hospitalizations due to malaria in endemic countries. And a connected point to that is how large the burden of outpatient visits and hospitalizations malaria still represents in these countries. So in countries where malaria hits hardest, malaria is the leading cause of outpatient visits and hospitalizations. And in many countries, it may still be the majority of outpatient visits and hospitalizations. That's to say, more than all other diseases combined, even today. And so in this brief, we are pointing towards some of the studies that highlight the very clear data showing the impact of the scale up in the 2000s on reductions in outpatient visits and hospitalizations from malaria, as well as some of the impact of the more recent wave of interventions, particularly seasonal malaria chemoprevention during the 2010s. And so what this really wants to show is just how much health system relief could be achieved with continued funding, increases in funding. But of course, the reality is that instead of that, we face a rebound in malaria due to funding cuts and the impact that will have on intervention coverage. So that's the gist of the brief. Of course, that has very clear connections to UHC in the context of the impact on catastrophic cost, often where you have severe malaria costs are not covered by public systems, and drop in access to prompt diagnosis and treatment, or even reduction in cases through prevention, will likely increase the pressure for catastrophic costs, increase the strain on health systems and their ability to provide a full scope of services for everybody reaching the health clinics. So that's really the context of this. The key messages, if they could be summarized, is that malaria is not only a parasite on bodies, that it's also a parasite on entire health systems. And that a malaria rebound not only threatens the lives of people directly affected by malaria, but it threatens the primary healthcare and universal healthcare that millions more rely on. I think those 2 points really capture the link. And I personally think the moniker of a health system dividend of malaria investment is quite useful, and that talking about the health system dividend is really a good counterpoint, good counter narrative to discourses about vertical programs. And I think the real takeaway is that this huge impact on health systems means that you can't see malaria control as a siloed intervention, that it has a really broad impact. And I encourage you to look at some of the data because it's really overwhelming to see just how big the footprint is, particularly in pediatric cases, but also in terms of health services for adults. So I think we have the link. Yeah.
Thank you. And Chase has really poured his heart into this with a number of partners in terms of bringing this brief to all of you. And so we've shared the link in the chat. You also have it over the GFAN listserv yesterday or earlier today. It's hard for me to tell from Conte. So please do go have a look for that. We are over the hour, and many of you have stayed with us. So we really appreciate that. And again, just really thank you, Françoise and Diane, for sticking with us through the conversation and sharing your reflections at this stage. We know there's, I don't know why one of you decided to call this a rolling replenishment, so we have to keep rolling, but there you have it. We'll blame you, but we'll also thank you for keeping up the momentum and keeping up the work and keeping us involved and up to date. So thank you very much for that. We really appreciate you joining us today. We will make the recording from today available with some of these resources that have been shared, including we'll make sure that we share again David's information about the USG calls that he's convening, this brief, etc. So thank you, everybody. The pledging summits happen, but we still have replenishment work to do. So thank you for joining us, and we'll keep working. Although there's still one more GFAN call before the end of the year in terms of working days for us at the GFAN team, which will be next week on the 17th, and we'll share information about that over the listserv. So thank you, everyone, for joining. Have a good rest of your days.
Bye, everyone.
Thank you. Bye-bye.
Bye bye.